create long video for YouTube using basic in video PKG on. The robot surgeons are already here. This isn't a glimpse into the future of surgery. This is surgery today. Right now, in operating rooms around the world, surgeons are guiding robotic arms with incredible precision, aiming to make certain procedures safer and recovery faster. Forget what you think you know about the operating room, because the robot surgeons are already here. They're an extension of the surgeon's eyes and hands, a partnership between human expertise and machine steadiness. And they are already helping patients heal in ways that felt like science fiction just a generation ago. For over a century, the basic idea of surgery didn't change much. A surgeon, a scalpel, and an incision. It's a practice that has saved countless lives, but it comes with challenges we all worry about. The classic open approach often required large incisions, which could lead to serious post-operative pain, a higher risk of infection, and long, frustrating recovery periods. Think weeks, or even months, of your life on pause, just to heal from the very thing meant to help you. Then came laparoscopic, or keyhole, surgery, a massive leap forward. It used smaller incisions, cameras, and long, rigid tools. While it was a game changer for reducing scars and recovery time, it brought its own set of hurdles. Early systems often limited surgeons to a 2D view on a screen, making depth perception a real challenge. Even with the later development of 3D laparoscopy, surgeons still had to deal with rigid tools that couldn't match the natural dexterity of the human wrist. Every procedure was a test of endurance, with the surgeon fighting the limits of their own tools. So, what if a surgeon's hand never trembled? What if their vision was 10 times more powerful than the human eye, in stunning high-definition 3D? And what if their tools could bend and rotate far beyond what the human wrist is capable of? That world is here. And its most famous resident is the surgical robot. Systems like the vinci robot aren't making decisions on their own. They're sophisticated platforms that are entirely controlled by a human surgeon. Think of it less like a self-driving car and more like the most advanced power steering system ever made. Here's how it works. The surgeon sits at a comfortable console, usually just a few feet away. They look into a high-definition 3D viewer, getting a magnified, immersive view inside the patient's body. Their hand movements are translated, in real time, to a set of robotic arms holding tiny instruments. These instruments can cut, cauterize, and suture with unparalleled precision, thanks to a system that filters out any natural hand tremors. The instruments on the arms have wrists that offer a range of motion physically impossible for a human surgeon with traditional tools. It's a symphony of human intellect and machine precision, all working toward one goal: a better, safer surgical outcome. To really get the impact, let's consider a story like Sarah's. A 45-year-old mother of two, Sarah was diagnosed with a condition requiring a hysterectomy. The diagnosis was scary, but the thought of surgery was terrifying. Her own mother had a similar procedure 2 decades ago, an open surgery that left a large scar, a painful 2-week hospital stay, and a recovery that dragged on for nearly 2 months.
Her doctor, however, offered a different path, a robotic-assisted procedure. He explained that instead of one large cut, she'd have a few tiny incisions, each less than a centimeter long. He showed her how he would be in complete control, guiding the robotic arms with enhanced vision and precision. He explained that this minimally invasive approach could mean less trauma to her body.
Sarah's story is an example of the positive outcomes that this technology can make possible for many patients. Stories like Sarah's are powerful, and they're backed by a growing body of clinical data. While benefits can vary by procedure, studies are showing real advantages. For certain surgeries, robotic approaches have been linked to lower complication rates and a reduced risk of converting to open surgery compared to traditional laparoscopy. One meta-analysis found robotic surgery was associated with a 10% lower rate of 30-day complications compared to laparoscopy. For patients, this can be life-changing. In many cases, it means shorter hospital stays, less blood loss, and a faster return to normal life. The cosmetic result of a few small scars instead of one large one can also have a profound psychological benefit. It's a win for the patient, a win for the surgeon, and a win for the healthcare system. With da Vinci procedures growing by 17% worldwide in 2024 and a total of roughly 2.7 million procedures performed, this revolution is happening at scale. Okay, let's talk about the robot in the room. The idea of a machine with a scalpel can be a little unnerving. But the robot in today's OR isn't an autonomous decision-maker. The surgeon is, and always will be, the captain of the ship. The system cannot move or make a single incision without the surgeon's direct command. So where does the AI come in? Think of the artificial intelligence as an expert co-pilot, not the pilot. Its role is to enhance, not replace, the surgeon's skill. For instance, some emerging AI tools can help analyze the video feed from the camera, helping to identify anatomical structures. Other AI systems can create detailed 3D models from a patient's preoperative scans, allowing surgeons to plan and even rehearse a complex procedure before ever entering the OR. During the surgery, the technology provides real-time enhancements. For example, the new da Vinci 5 system introduced force feedback technology, which allows the surgeon to feel the pressure and tension of the tissue they're working with, a sense of touch that was missing from earlier minimally invasive tools. Preclinical trials showed this could reduce the force exerted on tissue by up to 43%. The AI isn't performing the surgery, it's making the human surgeon better, safer, and more informed. The revolution doesn't stop at the operating room door. The same kind of AI that assists a robotic arm is transforming the entire field of medicine. In diagnostics, AI-powered tools are analyzing medical images like mammograms with incredible speed and accuracy. Some studies have found that AI systems are as accurate as human radiologists at detecting breast cancer, sometimes even better at spotting the earliest signs of tumors. In hospitals, AI is helping to optimize everything from scheduling to monitoring patients at high risk for complications. It's even accelerating the discovery of new drugs by analyzing massive datasets to find patterns that would take humans decades to uncover. What we're witnessing is the rise of a complete AI ecosystem in healthcare. From a faster diagnosis to a more precise surgery and a personalized recovery plan, AI is creating a seamless, data-driven journey of care. It's a system designed to reduce errors, improve outcomes, and put the focus right where it belongs, on the patient. The fusion of robotics and AI is fundamentally changing medicine. We're moving from an era of intervention to an era of precision, from long recoveries to faster healing. While robotic surgery is becoming increasingly common for many procedures, it's one of several effective options, alongside open and laparoscopic surgery, that your doctor might consider. This is just the beginning. What about the future? Imagine a day when surgeons can perform life-saving operations from hundreds of miles away through telesurgery, a field that is still in its early stages but holds incredible promise. Imagine surgical robots so small they can navigate inside the body without a single external cut. This is where we're headed. If this look into the present and future of medicine fascinates you, make sure to subscribe and turn on notifications. The robot surgeons are here, and they aren't replacing our doctors. They're empowering them. They are helping to turn the art of surgery into a science of precision, and in doing so, they are building a healthier future for all of us.